38-year-old gentleman who presented with a 3-year history of blurry peripheral vision. And he noticed that his symptoms were greater on the left than on the right, but denied any change in his color vision. And he had previously been followed by an outside optometrist, but got a new insurance plan and then presented to Joel Stein in October 2011. And his symptomatology prompted an imaging study which showed a large cellar and suprasellar mass. And his visual field testing showed deficits, much more significant on the left. And his endocrine review of systems was notable for reduced libido for approximately 3 years, fatigue, and a weight gain of 20 pounds over the past 4 to 5 years. And his past medical history was otherwise relatively unremarkable. He was on no medications and had no significant family history, and his social history was unremarkable as well. His pertinent physical exam findings: he was somewhat overweight at 215 pounds, had a normal heart rate and blood pressure, and his visual fields were full to confrontation, but he had obvious blurry vision at the extremes of both temporal fields, and it was more notable on the left. And he had no Cushingoid or acromegalic features. And his laboratory tests were quite unusual. He had a very low cortisol with a relatively normal ACTH, a high TSH, and a low free T4, which was actually more consistent with primary hypothyroidism rather than central, and a very low IGF-1 for his age, and also very low total and free testosterone, but a normal prolactin. And his adrenal labs were somewhat contradictory because the ACTH we would expect to be somewhat lower in a patient with central adrenal insufficiency. And preoperatively, he was started on hormone replacement with hydrocortisone 10 milligrams POTID, and that was started 1 week prior to Synthroid to avoid inducing adrenal insufficiency by rapidly repleting his thyroid hormone. And then he was started on Synthroid 75 micrograms daily, and he noted a significant improvement in his energy relatively quickly.